40% of the infertility cases are because of male problem. People misinterpret, sexual performance with fertility. We should make them aware that alcohol, smoking, their obesity, their lifestyle factor, everything is affecting the semen quality. So, and that in short is affecting their success of getting pregnant.
This is about a topic that really needs to be talked about. Burden is often carried by a single partner, and the topic is infertility. Like I think men need a playbook. Was there a moment where of frustration, of silence, where you were like,
loneliness almost, and I talked to my wife, which was amazing partner support, but at the same time, she's going through the IVF process too. So
quick shout out, if you want to learn more about this, he's written an entire book, IVF Playbook for Men. Please, it's on Amazon. Go, give it a read.
I would say that infertility is a journey for both the partner.
Don't forget to keep the romance alive through all of it.
yes.
Well, hello and welcome to the podcast. This one's extremely close to our hearts because this is about a topic that really needs to be talked about. I think, especially in India, in our part of the world, it is a topic that is often, just brushed under the carpet. It is a topic that it's super hush hush in all households. It's also something that I think the burden is often carried by a single partner, as opposed to both, or sometimes even families need to be involved, perhaps, right? But that does not happen, and the topic is infertility. Infertility is something that can truly shake your sense of self to a certain extent. It can rock your relationship in a not so good manner. And but if you kind of just start looking at the other side of it, I think the journey can also become a very wholesome way for the couple to bond. It can become move forward with it in a way that is open, that can be spoken about, that is based on trust, that is based on support, and all of those things. And I'm just so glad that we get to have this conversation today and speak about this topic. I am grateful that I get to learn about it from two people who are experts. We of course have Parchmen with us, who is a former NFL player and author of IVF Playbook for Men, which is, I think, such an inspiring concept. Thank you so much for authoring that book. It is much needed. Welcome to the podcast, Corey. And
Thank you for having me.
of course, we have Dr. Sonu with us here as well, who is the medical director at Yellow Fertility and IVF. And today we're going to have two experts talk about infertility and everything that it entails. So thank you so much for being a part of this podcast and for lending us your hours. Thank you.
Thank you for having me. I appreciate it.
All right, great. So let's dive in, actually, Corey. I have, just to kickstart, from being like an NFL player to becoming an author of this very important book. You've kind of seen it all. If I could tell you to just briefly describe this journey in like a few sentences to me, how would you kind of sum it all up for me?
Um, Actually, really understanding what masculinity is and what it actually is, because playing professional football, that's like the ultimate, especially in the States, the ultimate tough guy, macho guy sport you can play. But what I realize and what I know in guys that play at locker room, it's not what you think. It's a lot of guys that are struggling with different issues, insecure, things like that. So what the world perceives and what actually going on are two different things. So by me experiencing that aspect of it, I'm okay to speak about it, because we talk about things all the time in the locker room. We struggle with things all the time, but we step on the field, we got to pretend and put on the costume. And I think that if we stop doing that and let everyone know we're human beings too, we breathe, we feel, then I think that other people will also feel comfortable too, because we're looked at as being role models. And if we can be a role model on the field and off the field, and one of those things is being able to speak and talk about those things we talk about in the locker room, I think more men will speak up. So I was okay with speaking up about it from an aspect of, I know what quote unquote macho is supposed to be like, and I know what it actually is because I experienced both worlds.
Yeah. I'm glad you brought up the locker room. There's so much to be said about it, right? There is so much conversation about that macho image, oh, men don't cry, men don't hurt. But the truth is, I think, especially when it comes to infertility, a lot of men end up suffering in silence. Um, and I'm glad we're talking about it today. Was there a particular moment in your journey that you felt like I think men need a playbook? Was there a moment where of frustration, of silence, where you were like, I really need to talk about this? Can you pinpoint?
It throughout the entire journey, because I didn't have anyone to talk to or any resources to go off on. So as I was going through it, you're constantly seeking out different things, and you start to use the internet to seek out information. And what I found myself doing is trying to find out stuff that I wanted to learn about, because I wanted to make sure I felt a certain way. And sometimes you're biased. You look up things you want to look up, right? So throughout the entire process, I was always yearning for something else, but I couldn't have wrote the book until after I went through the entire process, because I was still trying to figure it out too. So I didn't want to write a book in the middle of me being confused about a lot of things. So afterwards, once we got to the end of the process, I felt comfortable about reflecting and being that resource. But throughout the entire process, you don't have anybody to talk to about, because once again, it's not a topic that's brought up much, and you feel lonely because, like, who do I go to? Who do I talk to about this? And that's kind of my thought process throughout the process, was loneliness almost. And I talked to my wife, which was amazing, partner support, but at the same time, she's going through the IVF process too. So, she's a human being. So sometimes you didn't want to like bring things up. So you become isolated in that aspect. So throughout the process, yeah, I thought it was needed.
Right. And if you're comfortable speaking about it, like I would love to understand your personal journey a little bit more. How did you discover that, this is a journey that you need to, undertake? And what was the first reaction like? And of course, you've grown through it. You had a lot of learnings. You said that, you suffered in silence and you spoke to your wife and you felt like, was there shame attached to it? Like what was that roller coaster like? Because it truly is one. If you could just take us through that day one of finding out to that entire journey that you've kind of taken after.
Yeah, so the day one of finding out was, initially, because you have to do a number of tests to figure out what's going on. So when they did the initial test, they realized, like, I don't have anything going on. So you have to take a series of tests. So the first test, they do a semen analysis, and then you go from there. Then the next test was, okay, let's see if it's a misdirection going on the wrong tube. So they, after I, would do the semen analysis, then did a urine test to see was any of it in the urine. So they came back, okay. So then I did another test to see if it was biological, if my body even producing it. So you take another test, and each time there's time frames in between. You're going through this, we had to weigh it out to see what was going on, because the ultimate thing was have a surgery to go inside to see what was going on. But that's so invasive. So the doctor's like, okay, before I even do that, let's see if other things are going on first. So once they figure out, like, I produce, I'm fine, but there's a blockage somewhere. So the next thought is, okay, let's do it to called a TESI, and that's when they go in and actually take a sample to see if it's somewhere in my body, you know. And as you're going through this process, once again, I'm trying to figure things out, like, what is going on, you know? And this has never been a conversation ever in my entire life with anybody, anybody. So, and another thing, I wrote the book. Reason why I wrote it, because as the doctor was giving, like, these terminologies and these things he was saying, you get so much information in the doctor's office, you don't comprehend all of it. And you hear words, you hear things, and you're like, what does that even mean? And sometimes you're too embarrassed to ask the question because you're in front of the doctors. And sometimes the doctor appointments are so fast. And not that my doctor was being fast, I can't be in there for two hours. There is a time limit. So that was another reason why I wrote the book, because there were certain times on the doctor's office, I didn't understand what he's even talking about. Tessie, what's a tessie? And he explained to you in that moment, but you're so caught up in your feelings and emotions that he's explaining it to you, but you're like, so I can have kids? That's all you hear. So every time they would give me a thought process on it, so I can have kids, that's all I would hear. And then later on, I'd try to regurgitate or re-say it, talk to people about it, and I couldn't explain it because I didn't hear anything. So by writing the book, now I was able to, like, give out those terms I was given and explain what those terms were. So once we went inside and they did the test, called a Tessie, they found, yeah, I do have it. So I ended up keeping that as a storage uh, process. So that was almost the same thing as doing a vasectomy, how they went in. So one thing the doctor said was, he said, you can do one or two things. either we just keep the sample we have and use that for the IVF, or we can go back in and see if we can find where the blockage is at. And that's a very invasive where they put a string down, they go through this whole process. He said, even if we do find out where it is, there's a possibility that we still can't fix it. So the thought was, well, just use a sample instead of going through the reconstruction type aspect, because once again, they didn't know where the blockage was at or how it was set up. Even they knew my body produced it, it just wasn't coming out. So once again, it was just trying to figure out, okay, do I want to go through another procedure to try to figure out where the blockage is, or take the sample we have and use that? So the first time we did the IVF, we just used the sample instead of trying to find out where the blockage was at.
Yeah. No, thank you so much for sharing that. I mean, I can't imagine what that moment feels like, especially, I mean, what you say that, all you hear, there's so many medical terms being thrown your way, but all you hear is that you can't have a child. We have Dr. Sonu here with us, and I would love to understand from you, Dr. Sonu. I mean, somebody who's dealing with this day in and day out. Um, of course, I mean, you deal with so many patients, but it is very emotional for parents who are walking into your clinic.
Yeah.
What is the doctor side of the story here? Like, how do you view it? Are you able to see it more pragmatically? What is your intake, especially if you also keep the cultural context here in mind, right? I think in India, um, a lot of onus of bearing a child, of infertility, is on the woman. The
Yeah.
second you're married, all the pressure is on the woman, like
Yeah.
from parents to in-laws to your bua chachi, everybody's saying like, where is the kid? And nobody's talking about all the other biological things that kind of come along with it. So what are your 2 cents on that, Dr. Soni?
Yeah, very true, Kopal. So the basically in India, like a male-driven society, the diagnosis and treatment of male infertility is still entangled with lot of cultural stigma and gender bias. So when it comes to the male infertility, there is a lot of reluctance to seek help.
Hmm.
Like people usually don't even undergo a very basic semen analysis test. I have seen a lot of couple, like I have a lot of examples where I see that the female is undergoing extensive testing and even invasive treatment also without doing a very simple semen analysis test. Because sometime in a male driven society, as I told, like in India, people think that that male infertility is wrongly like interpreted as a lack of manhood. So there is a lot of shame, denial, and obviously there is a lack of testing also.
And do you have like patients walk into your clinic where the where the husband is like refuses to take a test or says that it's not my problem to deal with? Do you get some of that as well when
Yeah.
being?
It is because of lack of awareness. So there is a infertility in India is still considered as a woman problem.
Correct, yeah.
People, as we know, as a fertility specialist, we know that half of the cases are because of male infertility also. So people, sometime I have seen, as I told, that I have seen a lot of example where if the female has undergone extensive testing and even the treatment without doing a very basic semen analysis test. So it is because of lack of awareness. People think that infertility is just a female problem, it is not a couple problem. So the society or the couple should be aware about this thing. They should be told that it is a male plus female problem. 40% of the infertility cases are because of male problem, and that is not even diagnosed sometime.
Right. And Corin, what about your experiences in the West? Do you face a lot of this there as well? Like when you walk into these fertility clinics or when you speak to your peers, for instance, do men feel the same way as they do here in India, where they feel like it's the women's burden to take and not theirs?
Well, I think that the common misconception is because I have semen, I can have kids. So
Right.
most men experience the semen experience where they experience. So the concept is, well, I can have kids. No one ever thinks about the sperm involved because we don't know the difference. I didn't know the difference. I thought semen and sperm was all the same thing. So I thought, well, as long as I can ejaculate, then I can have kids. It's that knowledge that people don't know. There's two different fluids. Sperm is a cell and semen is the fluid. But once again, because people don't know that, the assumption always is because I produce semen, then I can have kids. Once we get the message out there that it's not taught readily, in the states, sex education. Sex education is very taboo and very limited when they talk about it. So that's a very detailed process. So once again, most men, including me, think because I produce semen, I can have kids. You think that if nothing comes out, and that's where I'm
That's
in
very
it.
true.
So
That's very true.
hands down.
Because people misinterpret, sexual performance with fertility. They
Yes,
feel that if the male is sexually active, he is normal. That means he is fertile.
yes. Being unfertile, you would think, well, if nothing comes out, that's when I have it, but that's not the case, and that's where we need to educate more. Whether yeah, something can come out, it just doesn't have sperm attached to it, or is that sperm viable? Those are the things that I want to educate people on. Yeah, because I even had people joke with you all the time, like, so you were shooting blanks, like, not quite. These jokes you hear them because that's the conception that nothing coming out. But yeah, and once again, when you think that something's coming out, then if you're ejaculating, that means I can have kids. But it just educating people. No, a little bit more than that, a lot more than that.
Right. So what I'm hearing, like if we just take a two steps back, it's just lack of awareness to a very large extent.
Yeah.
People don't know, and usually people get to know when the problem is right in front of them. They don't know beforehand. So, like, just to take a quick detour, what do you think are some things that we can actually do to spread this awareness? Like, of course, this podcast is, for example, one thing that we can do. But what are some other ways in which we can actually reach out to probably like newly married couples and tell them that there is a large part, I mean, I don't know the percentages, probably, you would. What that there's a large chunk of population that is dealing with this issue, and these are the things that you need to be prepped for. This is the kind of mindset that you need to have. Could you give me some of your insights or your learnings on these? And the question is for both of you.
Yeah, so actually, we should focus on the awareness. Mainly we should focus on the male reproductive health also, which no one is speaking about. So even if we see about the school education, the public health messages, and even the fertility clinic, if you see the fertility specialist, there are very few male fertility specialists and andrologists because always male are not comfortable sharing their personal problem with the female fertility specialist. So we should provide the education around male fertility, around the male risk factor. We should make them aware that alcohol, smoking, their obesity, their lifestyle factor, everything is affecting the semen quality. So and that in short is affecting their success of getting pregnant. So we should create a environment, we should create a male comfortable environment. We should educate them that male infertility is also equally important as the female infertility.
Yeah. Yeah, definitely educating. If also if people explain the experience, it's an interesting experience when you go through the semen analysis. Um, I in my book I talk about it and I make a joke about it because when I go to the clinic to do the semen analysis, my thought was everyone's looking at me and everyone knows why I'm here. I think it's like this bell went off and the siren, like, here he is, here he is, here he is, the guy who's getting his semen. He can't, you know what I mean? You have those thoughts in your head. And, when you go back, the nurses take you to the back and they take you into a room and then you have to like do all these thoughts are going through your head about everyone's looking at me, everyone's looking at me. And then when you come out of the room, everybody's like, there goes the guy right there. And that was so far from the truth. No one even cared because they're professional. They do it all the time. And once you kind of get over that, I talk about in the book, they truly don't care. They're professionals. If you're doing a blood sample, if you were getting a hair analysis, it'd have been the same kind of experience. And that's what I talk about in the book once again, that they're total professionals. So you'll never feel uncomfortable. Anytime I felt uncomfortable, it was in my head. So getting that ahead of men, realize like no one's judging you in there. They see 1,000 men a day. You're number 1,001. So that's kind of what I did in my book. I wanted to get the stigma out there, like truly, truly. It's just like any other experience, any kind of other medical experience. No one knows. No one's looking at you. Everyone in there is mind their own business. So once we can get past that stigma of the process of getting the semen analysis done, I think more men will feel comfortable with getting it done. No one knows why you're there. They have a clue. But once again, it's all in your head, it's all in my head. And I joke about it in the book because it really was. No one cared.
Right. Yeah, it's just about normalizing it, like treating it like you said, any other medical procedure that you'd go through. Like that is exactly what it is. But I think a very important part of it is education, right? So, Dr. Sonu, we've of course spoken about the semen analysis, which is kind of the first step to just taking that test. Could you take us through that journey, like from that testing to the embryo transfer? What does it look like? What is that? Can you just basically, in a very layman, audience friendly terms, you could just explain our technology to us?
Yeah. So first
Yeah.
of all, I will explain that what all we need to get pregnant. So basically, there are four things which we need. We need the semen analysis, we need the egg, we need the uterus, and finally we need the fallopian tubes also. So we have to investigate these one by one. In case of female, we should do an AMS, that is a very simple blood test, that is anti-Mullerian hormone, that will be telling me the ovarian reserve. That means the number of the eggs the female is having. The second very simple test, as we know that there is contribution from both male and female. So from the male part, we should first do the semen analysis, which is also a very simple test, which is done with with an abstinence of 2 to 5 days. The male has to give the semen sample. We do a basic microscopic examination of the semen sample, seeing the sperm count, the sperm motility, and definitely the morphology, because these three features are very important for a sperm to fertilize the egg. The third thing which you should be doing in the female is a basic ultrasound to see her uterine health, how her uterus looks like, because we know uterus is a womb for the baby. So the baby has to grow inside the uterus. So we should see the health of the uterus also. If all these three things are normal, the egg is normal, the sperm is normal, the uterus is normal, then we should investigate the tubes also for the female, because tube is a part in the female reproductive tract where the egg and sperms fertilizes. So the tube should also be open. So these are four very basic testing which should be done in every couple when they are coming to a fertility specialist with infertility. So, depending on the situation, whether the problem is with the sperm, whether the problem is the egg or the fallopian tube or whatever, if we decide that we have to do IUI or IVF. So, IUI is a very intrauterine insemination, is a very simple procedure where at the time of ovulation, the male semen sample is taken, it is processed, the motile, good, healthy looking sperms are injected directly inside the uterus so that the egg and sperm can fertilized and can form an embryo. If I come to an IVF, that is in vitro fertilization, so as the terms indicate is a in vitro fertilization, the things the fertilization which is happening inside the fallopian tube during natural conception, in IVF it is happening outside the body. So we are giving some injection from day 2 of the period to the female to stimulate her ovaries to produce multiple eggs. When the eggs are mature, we are extracting the egg, we are taking the male semen sample, we are choosing the good quality sperm, we are fertilizing egg and sperm, we are observing the embryo in IVF lab for the 5 days to select the best quality embryo. And finally, when we get the good quality embryo of the 5 days, we are transferring this embryo inside the female uterus. So, this is the part of embryo transfer.
Wow. No, that is so
So
beautifully.
this is the entire journey which we are doing in IUI and IVF. So it's nothing abnormal. Obviously, the same egg, the same sperm, the same uterus in IVF. We are just doing under observation.
Right. So I have a lot of follow-up questions. So when you say the couple comes with infertility issues, it's usually um they've been trying for a few months and it's not happening. That is when they'll
Yes.
come to you and they'll
Yes.
let's do the tests now, right?
Yes. Huh.
Got it. Okay.
So basically, the couple should be investigated when they are trying for 1 year.
Okay.
If the couple is trying actively for 1 year without using any contraceptive and they are not able to conceive and the female age is less than 35 years, so this is the time when we should investigate both male and female partner.
Got it. And uh, I'm assuming when somebody does this treatment, they also expect very magical instant results.
Yeah,
Uh,
yes.
um I mean, I would first want to understand from Corey. Did you have that expectation when you walked into, a medical clinic and somebody recommended an IVF treatment and they were like, "This is what we're going to do," and you assume that I'm going to go through so much, so there will be an instant baby. Did you have that expectation, and what followed?
Yeah, we good question. We went into it so blind. We figured that okay, we follow it because what happens is and doctor can explain a little better than I can. You go through these steps, so you have you once you kind of get the egg quality. We had first of all we had high egg count. 8 of them were fertilized. Another win. So you have like there's like this ebb and flow up and down roller coaster type of feeling based on okay, all you need is one, right? So you start out with many. So it was this roller coaster and I'd had no idea what to prepare for. I never knew what to prepare for. And once again, not to do a same public book. That's why I wrote the book. I want men to be prepared for this roller coaster ride you go on because there's so many highs, so many lows. And like I said before, when we first did the quality eggs, it was 18. You're like, wow, we had 18 shots at it. And you realize like, no, it's just the beginning. It's something to be celebrated and happy, but there's still another long process to go in order to have the baby.
Yeah. So, Corey, from what I understand, you went through 4 failed cycles
Yes.
to get
Yes.
there. Was there,
No, I'm sorry. I'm sorry. Yeah, four. Yeah, four. Yes, four. Yes, four.
do you remember like any one moment of just doubt or just feeling like a lot of fear? Do you remember any one particular moment from that journey where you thought maybe this is not going to work out?
So the very, very first round, we used all three of our embryos. Then we had to start all over again. It was a daunting task because now I had to do another tessie,
Yeah.
and then also because we went through it before, realized that I don't know if she'll have quality eggs this time around. So once you realize you got to do it over again because you've been through the process, a lot of doubt creeps in because now I know that it was a miracle to get the 3 out of the 18. So now we got to start all over again. Who knows how many she's going to even have? They may go in, they may not can find any, or if they find some, uh, are they going to mature? Then are they going to fertilize? So because we went through the stress before and saw how we have the big number and doing out of 3, that second time around was a daunting process. Luckily the second time around we had 16 eggs and 10 of them fertilized. So that gave us a little bit of hope. But once again, you still on a roller coaster because you had 10 fertilized and how many are going to be, so it's a roller coaster going up and down. That second time around was really tough because we'd already been through it and realized that nothing's guaranteed here.
Yeah. I mean, I think you rightly described it as the roller coaster. And I mean, Dr. Sonu, there's obviously, I think the expectation would be an instant baby, but could you tell us what the reality of it actually is? Like, what are the odds? Um, what should one expect? Could you take us through that?
Yeah, yeah. So actually, in IVF, couple come with high hope and high emotion.
Yeah.
So first, couple thinks that if we are doing IVF means guaranteed baby in one cycle. So this is not the reality. See, in IVF, the success rate depends on lot of factors. It depends on the female age, as I told, the female reserve. That means the AMH, as Corey was telling, the number of eggs the female is having. So the age of the female, the ovarian reserve, and definitely the egg and sperm quality. 18 eggs doesn't mean we will be getting 18 embryos. Definitely, then we have to select how many eggs are mature. So IVF doesn't mean that guaranteed baby. It depends on lot of medical condition. It depends on egg number. It depends on the sperm number. It depends on egg quality, sperm quality, and finally what quality of embryo we are getting. So sometime even when we are getting good quality embryo, but good quality embryo doesn't mean that embryo will be genetically normal. As you told that one of the embryo was mosaic. So mosaic means that embryo was obviously not genetically normal. So there are a lot of factor in IVF, starting from the number of the follicles, the number of mature egg, the number of eggs getting fertilized, the number of embryo growing, and finally the genetically normal embryos.
Yeah.
And when we are doing embryo transfers, the another expectation in IVF is like, if I have done embryo transfer, that means the patient is pregnant. So
Yeah.
IVF transfer doesn't means pregnancy. Still, there is a one step which is left behind. The embryo has to attach. The process is known as implantation. So the embryo has to implant to the uterus lining. Then only we call it as a pregnancy. That means the positive test.
Yeah.
And IVF people sometimes, what I in India I have seen from the people coming from the rural areas, they think we'll keep on trying. If nothing happen, finally we'll get our IVF done. So this is not the case. So people are wasting lot of time in trying naturally, and IUI definitely undergoing lot of other treatment also, because they think that if nothing happen, we'll go to the IVF center, we'll get our IVF then and it will be successful. So IVF is not the last resort. As I told, ki IVF success rate also depends on so many factors. If we are having good number of egg, we are having good quality, definitely the IVF success rate will be high.
Yeah.
And there are other expectation also from the couples, like they think IVF is very quick and easy. They think they will go, they will get it IVF done. So it's very easy and quick steps. Definitely it's not an easy. There are a lot of roller coaster, emotional roller coaster associated with IVF. There are a lot of injections, scans, egg retrieval, embryo transfer. There are so many things the couple has to undergo in IVF. People think that IVF specialist method means they will correct everything. Doctor
Yeah,
obviously,
some magic.
exactly magic. So as a doctor, as a fertility doctor, obviously we can optimize the condition, but biology is always not predictable. There are a lot of factors which can lead to IVF failure also.
When you guys do embryo transfer, do you do multiple or multiple embryos or just one? And can you explain like that process? Because that was a thought process that we had to maybe after our second one or after our second round, that's successful. They were thinking about putting multiples in embryos in instead of just one. Can you explain that process?
Yeah, yeah. So like what we are doing, I mean what I am practicing, like if we get two good quality embryo, so we are doing two embryo transfer at one time. Why we are doing two embryo transfer? As I told, suppose if we are retrieving 10 eggs, all will not be mature, all will not get fertilized, all will not grow up to day 5. So even after day 5 also, sometimes there are chances that embryo will not be able to grow further. So to increase our chances of pregnancy, that means increasing the chances of implantation, we are doing two embryo transfer at a time. Suppose if one will not grow, other will grow and will get a positive test. Sometimes both will grow and we are getting twin pregnancy also. Sometimes both will not grow and we are getting a negative result. But if we are doing PGS testing, as I think it was done in your case, PGS, that means we
Yes.
are doing pre-implantation genetic screening. So why the embryo is not growing after day 5? In most of the cases, that embryo is not genetically normal. That's the reason that embryo is not able to grow further. So if we are doing genetic testing, if we are doing pre-implantation genetic screening, so we can do single embryo transfer also. In that case, the success rate would be very high. So doing two untested embryo and one PGS tested embryo, the success rate is equal.
Okay.
We do multiple, but definitely not more than two. We are not doing pre-embryo transfer because
Yeah.
our human body, our human uterus can tolerate, obviously can handle single pregnancy or twin pregnancy, but we cannot handle the triplet pregnancy. So we are doing maximum of two, not more than two.
Yeah, so I mean, I now understand that why an IVF cycle fails. Um, what happens though when it fails? Like Corey explained his journey a little bit, but is there like a limit to the number of attempts? Is there um do you start trying like right in the next month? Like how what happens after it fails?
No. So first I will
Yeah.
explain, first of all I will explain the reason why IVF fail. As I told that that all not the eggs are converting into an embryos, and obviously even if we get a day 5 embryo, all the embryos are not getting implanted. And as I already explained, sometime it is because of the embryo is not genetically normal. So if an IVF cycle fails, and suppose if I had done embryo transfer without doing genetic screening, if an IVF cycle fail, what I will do in the next cycle, it's not like that blindly will do the second embryo transfer. We know that anyways it is going to fail in the next cycle also. So if an IVF cycle fail, first we should rule out the genetic cause also. Because not all the embryo which I am getting in one IVF cycle are not genetically normal. So in IVF field, we should do the genetic screening, that is PGS, that is associated, I think I can say around 70 to 80% cases. That depends on the female age also. The PGS is not advised in all the cases. If the female is of advanced age, I mean more than 37, 38, or 40, then we should advise PGS. In other cases, the cause of IVF failure is sometimes uterine receptivity also. So the term is known as ERA, endometrial receptivity assay. As I told that if I do the embryo transfer, the embryo has to implant to the uterine wall for a successful pregnancy. So sometimes there is a problem in the implantation. That means the uterus is not receptive for the embryo. So in those cases, we are doing this advanced testing like ERA also. And sometime like in the female uterus there is some problem like flimsy adhesions, that like mild adhesions, any sort of infection or like a polyps, so we should rule out all these things also. We should rule out all these things before doing the first embryo transfer also, but if it is fails, then at least we should do hysteroscopy, we should do PGS, and we should do ERA also.
Right. Got it. Corey, you were also wanting to add something.
Oh yeah. Well, when you asked me about the process of once you have a failed a transfer, um, it's a lot depends on a lot of things. Uh, After because everything on paper was correct when my wife was 35, 34 years old at the time. You know, the quality everything was always there. So there was no rhyme or reason that was, you know, why it didn't happen. So then you start doing other tests to figure out if those things are going on, and all those tests came back fine too. So, there was never ever a rhyme or reason on why, exactly why, it wasn't happening. Just never found a reason why. So a lot of it depends on if you have the money, resources to continue to keep trying. If you continue to, if your wife and my wife, for example, I depended on her to let me know, okay, whenever you're done, I'm okay with it, because she was doing 99% of the load once they got my semen. So I just depended on her and say, hey, when we went on a third one, we're doing a fourth one. At any point in time, because she's taking shots every single day. She's doing so many different things, but she was a trooper. So I depended on my wife at that point in time to tell me when we were ready to be done. Because once again, our second round of IVF, we had 6 total of viable embryos,
Yeah.
and they were all PG tested. But does she want to do this 10 more times or 8 more times? So it was a matter of us finding out, how long we want to go. But then the also flip side of it was we had to put in our minds that if this doesn't happen for us, we still have to have a great quality life. And that's when we begin to relax, when we start letting the pressure go of we got to have a child. We had to say to ourselves, if this doesn't happen for us, we still have to figure out how to have a great life. And then once we got to that point, things, that's not why it worked at all, but the process became a little different for us because we had to figure out, okay, this might not be our option for us, and that's okay. How can we still have a great life? And that's kind of what we did.
Right. And I mean, as a man, also like seeing your wife or your partner go through that, um, there must be so many feelings, right? And is guilt one of the feelings, like, to see the other partner kind of take a lot of burden of this thing that both of you have to carry it, in the journey of life, but at that moment, like, she is bearing the most physical brunt. So, and of course men are bearing the emotional brunt of it, but it's not as out there. So if you could just weigh in on both these things.
Yeah, good question. It was twofold guilt for me. It was guilt from the aspect of seeing her, having to take several shots per day, seeing her have to go to appointments, do blood draws, all those things. But then also theoretically, in my mind, we're here because it's male factor. So the guilt was we're even in this thing because of me. And once again, my wife was amazing, never made me feel that way. But you internalize things yourself. And that's one of the thoughts that I had, that, the reason why we're here is because of me. And like I say in the book, you have to get over yourself, because at this point in time, it's not about you anymore. It's about your family and what's best for you and your family. So you have to push through, and it's okay to have that feeling, that pity party for yourself. It's feelings. You feel that way. But you have to realize the bigger picture is, how can I support myself and my wife through this process? So like I said, it was twofold guilt for me. One, seeing her go through, but also it being male factor. But once I got out of my own way and started thinking more about my family and our future, then the process became a little bit easier for me.
Yeah. No, that's great. Did you get like a very funny or very wild advice in this process from family, friends, anybody? Do you remember something somebody said?
It never stopped. And what I learned was I had to show grace from people, because they actually meant well. They were giving awful advice, but it was only based off their life experience. No one knows about IVF at all. So what they were telling me were things that, they thought, like, like I said, for like, spin around, eat 3 eggs, jump up and down, do a flip, drink this, eat this, do that. They give you all unsolicited advice. And what I had to be clear and tell them was, this is a medical issue, and I'm leaning on my doctors for it. And I think if you had anything else going on with you, you broke your shoulder or anything like that, you would say the same thing, like, hey, no, this is a medical issue. I'm following my doctor's order. But, you thank them for the advice and you appreciate it. But at the same time, while you're going through the process, it doesn't make you feel any better. So what I learned to do was make sure I talk about it on my own terms. And if someone brought it up, I was quickly able to revert the conversation to something else. Because once again, while you're going through the process, you're trying to, which I would say, someone to try to educate as much as possible. And even in the book, I talk about, if you're a partner or know someone going through it, ask as less questions as possible. Let the person go through the process, lead the conversation. And what you don't want to do, and this happened to us, we told people that we were, doing a transfer, and we had people call us every day. What happened? You hear results? Hear results? And then as the phone ringing, you think it's the doctor calling, but it's someone else calling saying, "Hey, you hear anything?" You're like, "No, stop calling me." So you try to educate people as much as possible, but keep it on your terms. But I would always tell people, "Hey, it's a medical issue, and I'm depending on my doctors for advice." But thank you for the advice.
Always thank you for the advice. But Dr. Sonu, is it different in Indian context? Because I think marriages are much more complex in India because families are involved and there is, um, like we'd also earlier mentioned, so much onus on the daughter-in-law or the daughter to kind of bear the entire brunt. Is it much more complicated? What kind of, do you have any experiences that you would like to share from like men who walk into your clinic, or the kind of or even advice that you would like to give to Indian men for that matter?
So yeah, actually, when the couple come with the infertility, I feel that sometimes men feels very, left out.
Yeah.
So that is the first feeling which I see in case of male partner. So why this is because the entire biological process is centered around female. She is undergoing scan, she is undergoing blood investigation, she is undergoing egg retrieval, embryo transfer. There are a lot of things she is undergoing. So the entire focus is around the female, not only biologically, like emotionally also. The family, the society, so everybody is concerned about female only. So sometimes I feel that male feel very left out, and this is the actual feeling actually. Because they feel that they are not doing anything, but what I feel as a fertility specialist, that we should counsel both the partner as a couple, we should counsel them. We should give them a joint consultation. We should counsel them every step. We should involve male also in all the consultation, in all the counseling, explaining the role of semen analysis also. We should advise how he should give the semen sample, what is the timing, what all the factor he should consider, like he should consider his lifestyle factor also, alcohol, smoking, obesity, everything. He should focus on his lifestyle factor also. So in joint counseling, in joint consultation, involving the male in all the in entire IVF journey, we can feel that he will be motivated, he will not feel left out, that he is not the part of journey.
And even in, like, once again, I talk about in the book, and I can't talk about the book, but
Mm.
you can find ways to be assist your partner. Like initially, I was helping out doing the shots, and I got fired from that job. It was like it's like it just felt better when she did it. But what I found was, okay, she wanted ice before she started the process of taking the shots or heat. I would do things that she needed to be done prior to it. So if she needed ice before she did her shot, I would be the one to get the ice and apply the ice. And if she needed like heat, afterwards, that's with the progesterone, I would be the one to massage it in. So you can find different areas to help out
Exactly.
because once again, you just got to figure out where that space is and find it out. There's a lot of things that can be done. You can get off the sideline, definitely. It's not, you're not the main player, but you can be the assistant player, help out a lot. So massages, like I said, just the heating pad, and even like when I would take notes in the meeting. So, because my wife, like I said, was hearing so much stuff also, when I started taking notes, now I was able to get involved with the conversation. But the biggest thing I learned was to be a great listener. What I learned was, I thought that when my wife would talk to me about stuff, let's put a strategy together, put a plan together. I'm getting the playbook out, I'm getting the notes out. And she was like, no, I just want to talk and just hear me out. And that was one of the key things that helped out a lot was everything didn't need to have an opinion or advice. Sometimes just being a great listener as a partner is
Exactly.
worth its weight in gold. So that's why I advise our men to do in the book, like just be a great listener. And I asked my wife, or I asked your wife for your partner before the conversation started, are you looking for advice? Or you told me to listen. And then once you get to that point, you can have that great conversation. And even that's still working today in my marriage now.
In the evening, the couple should take out at least 5-10 minutes to discuss the entire journey, what she is
Yes.
undergoing, and especially the male should be ready for the hormonal mood swings for the female, because she's undergoing a lot of injection, lot of hormonal changes. So it's not about she is throwing tantrum; it's about her hormonal mood swings. So the male should be ready for that also.
Right. No, those are some excellent tips. But when I'm hearing this, when a couple sets out to have a baby, it's such an exciting thought that you'll grow a
Yes.
family. You're not expecting the road bump, you're not expecting the roadblock. And then suddenly, for at least some time, your life becomes about these medical procedures. It becomes about hospital visits and injections and hormones and all of those things. Corey, from your experience, how do you make room for romance in this kind of setup? How do you keep that alive? How do you keep the relationship going? Uh,
Yeah, I would say despite, us going through the journey of IVF, we remain best friends, we remain romantic and all those things. Um, what we you try to not let the IVF process control your entire life, even though it does. I mean, we try to separate it at times, even though it's hard. So that was one of the things we try to do best was not let this IVF process control our entire life, even though it's hard. Like you would think to yourself, okay, let's go out to eat. Let's get IVF off our minds and go out to eat. Then you see a billboard with diapers, or see like a big sign with diapers. So it was hard to impossible. It was impossible to get it off your mind totally, but at the same time, you have to figure out ways to still maintain and live your life without letting it control your life. IVF became a part of our life, but it didn't control our life. And when we cut the perspective, then we were able to maintain our emotional intimacy and all those things as we went through the process.
that's beautiful. Okay, now I have a quick segment for you guys. It's called IVF Mythbusters. I'm gonna throw some statements your way, and both of you to tell me whether they're true or false. Of course, you guys will know the answers, but it's mostly for our audiences to learn and understand things better. Okay, are you guys ready? We'll be quick about this.
Yes,
Okay.
yes.
Number one, infertility is always a woman's problem.
No.
False.
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 As I told, half of the cases are because of male infertility also.
Exactly. 40 to 50% cases are because of male factors, actually. Yes.
Yeah.
Statement two, if a man can get an erection, his fertility is fine.
False.
No. Because as I told, that couple usually, the people usually misinterpret sexual performance with fertility.
Yes.
Yeah.
The male who is having zero sperm count, obviously he will be having semen sample, but semen sample or sexual performance doesn't mean that he is fertile.
100%. So, like we discussed, fertility depends on sperm quality and not just your sexual performance.
Yes.
Statement number three, you can't get pregnant naturally after doing IVF once.
No.
No.
False.
False. Yes.
Because in IVF we are just assisting.
Yeah.
We are not doing anything. We are just taking out the egg, sperm, we are combining, and finally we are doing embryo transfer. I have a lot of example where the couple has undergone one IVF cycle, in the next cycle they conceive naturally.
Right. Does it
And
even
not even in IVF they have conceived. Sometimes, couple have two IVF failure. And when they are like, we are don't want to do anything, they are just completely out of the treatment and they conceive naturally also.
right? Brilliant. So it is
And,
IVF.
and like with me, me having a blockage, that blockage never stopped. So my condition never changed. So no matter what, it's what I have to live with.
Right. So some couples do conceive naturally after IVF, and
Yes.
IVF doesn't really block natural fertility in any way. Like you mentioned, it's just there to assist or aid the process of
Exactly.
fertility. Okay, statement four. IVF babies are not as healthy as natural babies.
False.
False. False.
Yes.
IVF baby is as healthy as a natural pregnancy baby. So if I show you photos of two babies, obviously no one can comment which is normal conception baby and which one is IVF pregnancy baby.
Right. That is beautiful to know. They're as healthy, as normal, and as loved
And if
as.
I tell about healthy, like in IVF, when we are doing PGS testing, as I explained, when we are doing genetic screening, so we are just ruling out all the genetic factor. Which, if I conceive, if somebody conceive naturally, obviously there is a risk of genetic abnormality, which naturally we are doing during the subsequent scan, that we are ruling out that the baby is not having any genetic problem. So if you are doing IVF and we are doing genetic testing, obviously we are ruling out genetic problem also. So the baby is even more healthier when we are doing genetic testing in case of IVF.
Right. That's interesting. Awesome. Okay, last statement, statement five. If IVF didn't work out the first time, it will never work out.
And, false.
Because as I told that there's a list of factors. There's a list of tests, advanced testing, but definitely we cannot do all the testing in all the couples because it is not advisable. So we do very basic testing, we do IVF. If it is failed, then definitely we do some advanced testing. So one IVF fail doesn't mean that they will not be able to conceive, never. because we do some advanced testing, we do some PGS, we will do ERA, we'll do hysteroscopy. Definitely, we'll rule out the reason why IVF failed, and then we will try again. So one IVF failed doesn't mean that it will never be successful.
Yeah. In fact, a failed IVF cycle means that you have something more to learn and
Exactly.
you can figure
Yes.
that out.
Yes. Yes.
Superb, great. You guys passed 100 on 100.
Oh, thank you.
I wouldn't have expected anything other than that, but thank you so much. And
Thank you.
also, this has been a wonderful, 1 hour. Thank you so much for taking out the time to do this. I personally learned a lot, and I'm going to take this to my friends in their 30s, tell them more about it. And any final concluding words from both of you? Corey, any concluding thoughts?
I would just say to my fellow men, there are a lot of us out here, and it's okay. That'll be my biggest thing. There's a lot of us out here, and it's okay. Just get through the process, listen to your doctors, and if you need someone to talk to, if you open up, you'll find someone. Because I found a tribe of people going through the same thing, and we're out here, and it's a medical issue. So don't worry, you didn't do anything wrong, or nothing wrong with you. It's part of mess.
Yeah, and quick shout out if you want to learn more about this, he's written an entire book, IVF Playbook for Men. Please, it's on Amazon. Go, give it a read, tell your friends about it. I think it's the need of the hour. We need to talk more and more about it. We especially need more and more men to know and learn more about this. So, thank you. Dr. Sonu, concluding words?
So yeah, I would say that infertility is a journey for both the partner. It's not only male problem or only a female problem. So one of the most crucial step, as I told earlier also, that the male testing should be done earlier to rule out male factor also, because half of the time it is male factor. Second thing, that the male should be involved from the starting only. Very starting from the diagnosis till treatment, the male should be actively involved, explaining all the things. And I would suggest that the couple should support each other during this IVF journey. I know there will be a lot of up and downs, there will be unexpected hurdle also during this journey, but the couple should support each other. They should walk this path together, because the couple's unity, their patience, and the shared strength is as important as the medical treatment.
Yeah, that's so true. That's so well said. And don't forget to keep the romance alive through all of it.
Yeah,
Yes.
yeah.
Yeah, that part. Yes.
Right. Thank you, Gauri. Thank you, Dr. Sonu, for sharing your insights. This has been absolutely lovely. I'm sure it's going to make our viewers feel like all is well, and it absolutely is. So, thank you so much for your insights today.
Yeah. Thank you, Corey. Thank you for, sharing your personal journey. And thank you, Popal, for giving this opportunity. Thank you so much.
Thank you. Thank you.
Thank you. Thank you. Bye bye.